Most people think blocked arteries appear suddenly, a heart attack, out of nowhere. But in reality, your body usually sends small warning signals years before that happens. The problem? Most people ignore them or mistake them for normal aging. Today, we're going to look at 7 early warning signs your arteries may already be getting blocked. Some of them might surprise you. And if you're over 50, these signals become much more important to notice. Sign 1. Chest pressure during activity. Not always sharp pain. Sometimes it's just pressure, a tight feeling in the chest, especially when walking fast, climbing stairs, or carrying groceries. This happens because narrowed arteries can't deliver enough oxygen-rich blood to your heart muscle. When you stop moving, the pressure often fades, which is why many people dismiss it. But it's one of the earliest signals doctors watch carefully. Sign 2. Shortness of breath. I'm getting older. But when arteries supplying the heart become narrowed, the heart has to work harder. And that can make you feel winded, even during activities that used to feel easy. Walking uphill, light housework, even simple daily movement. Sign 3. Pain in the jaw, neck, or shoulder. Heart-related discomfort doesn't always stay in the chest. It can travel. Sometimes the pain appears in the jaw, the neck, the shoulder, or the upper back. This happens because the nerves that carry heart pain signals also connect to these areas, which means the warning sign can feel confusing. Sign 4. Cold feet or poor circulation. Your heart doesn't only supply blood to itself, it supplies blood to your entire body. When arteries begin narrowing, circulation to the legs and feet can decrease. People often notice cold feet, tingling, or numbness in the legs, especially while resting. This can be an early sign of peripheral artery disease. Sign 5. Unusual fatigue. Not the normal tiredness after a long day. We're talking about unusual fatigue, feeling exhausted from activities that never used to drain your energy. When arteries narrow, your body must work harder to circulate blood, and that can slowly reduce your overall energy levels. Many patients describe it as something just feels different. Sign 6. Slow healing wounds. Cuts or small wounds that take longer to heal, especially on the feet or legs, can sometimes signal poor circulation. Healthy blood flow delivers oxygen and nutrients needed for tissue repair. When arteries are narrowed, that process slows down. Sign 7. Erectile dysfunction. This one surprises many people, but for men, erectile dysfunction can sometimes be an early cardiovascular signal. The arteries involved are very small, which means they can become affected by plaque buildup earlier than larger arteries in the heart. Many cardiologists actually consider this an important early warning sign, sometimes appearing years before heart symptoms. The important thing to understand is this: blocked arteries rarely develop overnight. They build slowly, quietly, over many years. And your body often gives early signals if something isn't right. The key is learning to recognize them before they become something more serious. If you found this helpful, consider subscribing, because understanding these early warning signs can make a real difference in protecting your heart.